Okay, so before I start with inserting the NG tube, I'm gonna make sure I have all the supplies. So I would make sure I have the tube, tape, gloves, a 60 milliliter syringe. I would also have the water-soluble lubricating jelly, tissues, cup of water for the patient, and emesis basin, pH gastric test strip, my stethoscope, and I would get suction if it was prescribed, and I would also have a safety pin and a elastic band. So once I've got all of my supplies, which I do, I am going to perform hand hygiene and introduce myself. So hi, my name is Brittany. I am going to be your nurse today, so I'm just going to put some gloves on, and can you please tell me your first and last name? Okay, and your date of birth? Great, so I verified that this is the correct patient. Now I'm just going to explain the procedure. So today we're just going to be inserting an NG tube. I am going to insert it in through one of the nares, and it's going to go up and down, back into the back of the throat and down to the stomach. Then I am going to raise the bed to a comfortable and safe working height for me and the patient. And I'm also going to raise the head of the bed to, high Fowler's, if it's tolerated by the patient. Then I'm going to assess the nares for any irritation or obstruction. So I'm going to have them hyperextend their neck. Looks good. There's no obstruction, irritation, or everything is intact, so it looks great. Then I'm going to have the patient obstruct one of the nostrils, and I'm going to observe the airflow between each nostril separately. And I'm going to choose the nares that has the best, most clear airflow. Then I'm going to prepare the tubing, so I'm going to measure from the tip of the nose to the behind the ear and down to the xiphoid process. Get that out. Going down. Okay. And it's at 50, so it's at the tip of the nose, behind the ear, down to the xiphoid process. I would mark it with a pen, make sure I have the 50. Good. Then I am going to, I'm just going to set it on the sterile paper, and I'm going to place a towel over the patient's chest, and I'm going to open the lubricating jelly, and I'm going to lubricate the tip of the tube to help tolerate it better. And I'm going to insert it into the nares and have them hyperextend their neck. Okay, excuse me. And then when it reaches the oropharynx, they're going to likely feel it. And if they gag, I'd give them a second, but I'm also going to encourage them to drink. And with each swallow, I'm going to insert the tube 2 to 4 inches each time until I reach the marked length. So I'm going to have them tilt their head forward and drink. Great. And if they were gagging, I would pause and give them time to breathe until they're ready to continue. Once it reaches the desired length or the marked area, which it has, I'm going to do just a rough taping to the tip of the nose. I do a better job after I verify the placement. So now I'm going to aspirate the stomach contents and test it with a pH test strip. Aspirate it, make sure it's stomach contents, and then I would test it in a separate basin. And I would take 5 to 10 milliliters of air, and I'm going to inject it into the NG tube and listen over the epigastric area for a whoosh of air. I'm going to say that I did hear the whoosh of air. You can check the placement as well beforehand with with an x-ray, but I checked it with the pH strip. So once I have done that, I'm going to make sure that the tube is secured well with a piece of tape onto the tip of the nose, sorry. And I'm going to attach the end of the tubing to either the feeding or suction, or just clamp the tubing, whatever is ordered by the provider. Then I'm going to secure the tubing to the patient's gown so it doesn't tug or pull. Then I would lower the bed to a safe height for the patient, and I would establish a plan for daily NG care. Once I have done that, I would remove my gloves and put it in a proper trash bin. Perform hand hygiene. I would make sure the patient is comfortable and safe, and I would give them their call light, and I would leave to go document the procedure, the assessment, and the patient's tolerance of the procedure.